Welcome back, everyone. It's March at last, and this is Pospo and BRAINCAST for mostly learners. No, I know I'm not wearing my fancy red encephalitis t-shirt. Kind of miss it, to be honest, but it's not World Encephalitis Day every day, which is exactly what we celebrated last Monday alongside Dr. Tom Pollack and Professor Tom Solomon, two of the leading figures in encephalitis research. If you missed it, no worries, we have you covered. Video, YouTube, audio, Spotify. Make sure you stop at the Encephalitis Society website to show your support. www.encephalitis.info. But enough with viruses and inflammation and relentless cytokine storms, because it's time to travel. No, not that kind of travel, I'm afraid. That will have to wait for a few more months. But we can still travel, mentally, back in time. So jump on your time capsule and get ready for a blast from the past with me. Not a psychiatrist, not a neurologist, but someone way more fascinating and exotic than any of the other medical specialties out there. And listen, a Seriologist from the Wolfson College at the University of Oxford. Having written on diverse topics in the history of the ancient Middle East, she serves on the management committee of NARAIN, an NAHRC funded project in sustainability and cultural heritage in Iraq and neighboring countries. She's also on the council of the British Institute for the Study of Iraq. What brings her here with us today, though, is her work in the history of science and medicine, focusing on the use of metaphor in the description of mental distress. BRAINCAST people, Dr. Moudhy Al-Rashid. Moudhy, welcome to BRAINCAST.
Thank you. Thanks for having me.
Moudhy, you can imagine how excited I feel to have you here. 99% of the times on the other end of the screen, there are usually, psychiatrists, neurologists, neuroscientists, people that despite of the seniority, their amazing achievements, we all have something in common. We went to medical school, we love the brain, and the only difference is that all these people were way smarter than I am and became professors, but as a seriologist, that's a first. So before we even start, though technically we've already started, can you please introduce me to the everyday life of an Assyriologist?
Sure. Having had that lovely introduction, I feel still like a little bit of an imposter since I'm not a neuroscientist or a psychiatrist, but I'm very happy to introduce everyone to the world of Seriology, which is essentially the study of ancient Mesopotamia. It's a kind of archaic job title, and it comes sort of the way Egyptology means study of ancient Egypt. Assyriology includes the study of ancient Assyria, but it's actually quite a bit broader than that. It's the title for a person who specializes in the languages and cultures of ancient Mesopotamia from around 3500 BCE until the end of the first millennium BCE. And it's someone who studies essentially the texts that have been written in cuneiform and the culture that we can resurrect from those texts. So it's part philology, which is a fancy way of studying words, and it's part history based on the translations of texts that are generated by Assyriologists. So that's the 1 minute summary.
Fantastic. Okay. So then what we can do, let's transport ourselves back to these mystical times where 5,000 years ago in the depths of Mesopotamia. So tell me, what's around me? What's the terrain like? The weather, the people, how do they look? What do they wear? What language do they speak?
Okay, so crash course in ancient Mesopotamia. The first thing to note is that we're referring to a pretty huge area that's now covered by Iraq and Syria. And I think this is actually the first time I get to ask someone who speaks Greek whether Mesopotamia means between the rivers. Is that right?
Yes.
Okay,
Yep. You
so
know your stuff.
So far, so good. So ancient Mesopotamia, in fact, refers to a region rather than a civilization or a culture. And it refers to the region between the Tigris, between and around the Tigris River and the Euphrates River. And various empires, cultures, civilizations rose and fell in this area over the course of several thousand years. So we're talking about quite a long period of time and quite a large area. So it's hard to sort of say exactly what everybody looked like or what the exact weather would have been, since it is so vast. But essentially, we have quite fertile plains around these rivers that made possible early farming techniques to be developed. And these techniques allowed for surplus agriculture. So essentially, irrigation allowed for people to produce enough food for everybody, so not everybody had to be participating in agricultural activities. And at the same time, there was a need was created to keep track of all of the items being funneled as a result of these fertile soils. And this leads to the development of writing to keep track of all of these things. So we have a kind of really nice match between the terrain and the Fertile Crescent, as it's sometimes called, and the development of this system of recording information that we still use today, albeit a different writing system. And the writing system that was developed is called Cuneiform, which gets its name from the wedge shape of the characters that are impressed into clay. They look almost like little tetrahedrons, just that make up about a repertoire of about 1,000 different signs. And it's this writing system that the different civilizations have in common. So it was used to write various languages, the first one being Sumerian, and then later Akkadian, which is it's the earliest known Semitic language, so it's related to languages like Arabic and Hebrew, and even Hittite, which is an Indo-European language, so from the same language family as many European languages in use today. So cuneiform is a writing system, and it is what our medical texts are recorded in, although the primary language of these texts is Akkadian, which is nice. We kind of only have to specialize in one language to read these medical.
And Moudhy, unsurprisingly, one of the first things that attracted our ancestors' attention was their body, its functions, but also its malfunctions and everything in between. And while most people think about, Hippocrates when talking about medicine in the ancient times, the truth is that Hippocrates was trending in the ancient Twitter around 5th century before Christ. But the history of medicine goes way beyond that. And it seems that the Babylonians and the Assyrians were quite good at this. So tell us about the ASU and the ASIPU and the Babylonian NHS, if you like.
Sure, I love that analogy. Sure. So in both Assyria and Babylonia, so beginning around the 2nd millennium BCE all the way to the end of the 1st millennium BCE, we have two medical professionals, among others, and these are the Asu and the Ashipu, or sometimes called the Mashmashu. Asu is often translated as physician. This is not without problems. And the Ashipu or Mashmashu translated as exorcist, which is also not without problems. We're going to stick to that for now anyway, while I also will try to describe a little bit more about the different roles. There are, however, other medical professionals, before I talk a bit more about the Ashipu, including midwives. So the Akkadian word for that is shabsutu or shabsu. And sometimes diviners were involved in the medical process or some aspect of the medical process. So seers is another way to translate the Akkadian term baru. So the Ashipu is very interesting. So even though it's translated as exorcist, which in a way seems to sort of dismiss the role in the medical process, played a really important role in medicine. The Ashipu is one of the 5 main scholarly professions in general in ancient Assyria and Babylonia, alongside, say, for example, astronomers or diviners again. They're both a medical professional and a scholar responsible for other disciplines within the scholarly corpus. And it's translated as exorcist because they're largely responsible for addressing the supernatural causes of disease and illness, which is part of every disease and illness, not just mental illnesses. But they, in fact, draw from a multitude of both magical and medical approaches. The Ashipu also made house calls, which we have some nice evidence of.
Go ahead. I have to say, though, that being a doctor in the Assyrian times, wasn't an easy endeavor. Not that it's easy now, but I was reading that if a slave died as a result of an operation, the surgeon was to replace the slave by another. If, however, a free man died or lost an eye through an operation, then the physician's hand is to be cut off. And I don't care about the consequences. I care more about, it's interesting how the value of life is dependent on one's status. So you kill a slave, you just have to replace a slave. You kill a free man, then okay, they just cut your hand. Okay, not just, but still. So which actually shows that not much has changed. So were class and race inequalities evident even that back in time?
Yeah, so this is an interesting set of legal provisions that you're citing from something called Hammurabi's Laws, or sometimes called Hammurabi's Law Code. It's not exactly a code, which is why it's better to just call them laws. And it's from the 18th century BCE. And these provisions, as you said, govern, in a way, medical malpractice, let's say, just to oversimplify it slightly. And you're absolutely right. The punishment for causing bodily harm to an awilum, which is a certain class of free man, is much more harsh than the consequences of harming or causing bodily harm to a slave. In fact, the provisions, there are 3 in a row. And the first one, the punishment for blinding an awilum, is to cut off the hand. And the second one, the punishment for blinding a mushkenum, which is a different social class below the awilum, is a certain monetary amount. And then similarly with the slave, there's a monetary value essentially assigned to their life. So it does assign value, literally, to people's lives in a way that suggests inequality in not just the value of the people's lives, but in the consequences for medical malpractice. But it's also interesting, so in addition to that, these provisions are interesting because they tell us a bit about the regulation of medical activity. So while we're not sure to what degree, if at all, any of these laws were applied or enforced, they didn't come from nowhere, let's say. They weren't generated out of a vacuum. There must have been some social underpinning for them. So from a strictly medical perspective, they're also interesting because they tell us that surgery was performed and what the tool might have been, which is, in these cases, a bronze scalpel or lancet, as it's sometimes translated. There is also archaeological evidence for the fact that surgery was performed. So, for example, in Babylon from the 1st millennium BCE, so we're fast forwarding about 1,000 years, various surgical instruments like needles, scalpels, hooks, a little bit really dark, and probes made out of bronze and bone have been excavated. But there's also, there are sometimes receipts for bronze that has been received by a physician to make surgical tools. So these laws are interesting both for what they tell us about the patients and the different rankings in a way of them, as well as what they tell us about medical practice, or what they hint at.
I mean, what is really impressive, though, is that Assyrians had their own diagnostic classification system, like the DSM or like the ICD-10. So Labat in the 50s, wrote that illnesses during the Assyrian times were organized in 2 major collections, known as the Diagnostic and Therapeutic series. Tell me more.
Sure, yes. So again, as both the Assyrians and the Babylonians made use of these 2 broad categories of text, and what Labat found in the 50s still stands. So there's a diagnostic series that he did an initial amazing translation and edition of. That's in antiquity, so in ancient Mesopotamia, it was referred to as sakiku, which is the Akkadian word that kind of translates to symptoms, but we just call it the Diagnostic Handbook, and we're going to stick with that so that I'm not throwing Akkadian words left, right, and center. It's made up of 40 clay tablets that are divided into 6 chapters. The sort of bulk of it is a chapter that's organized from head to toe, which is interesting. But it also includes a chapter dedicated to seizures or epilepsy, as well as a chapter for pediatrics, for example.
Wow.
And then alongside this sort of canonical text, I used to put that in quotes because it doesn't quite mean the same thing as it does for, say, biblical studies, there's a therapeutic handbook, which is known primarily from a catalog found in Ashur, which is a city in the north of Mesopotamia in the Assyrian heartland, really. And the first part deals with remedies covering, again, head to toe. And then the second part is thematically organized. And interestingly, It includes sections on things like skin diseases or sexual health, but also mental conditions, including, for example, lines that begin with, if a man constantly feels pain or tenseness and heartbreak, or if a man is always frightened and screams a lot, that sort of thing. So there's actively a chapter on mental conditions. But there are lots of other therapeutic texts outside of this corpus, and in fact, there's a lot of evidence within them that there was experimentation and change within these texts, that they performed experiments to see what remedies did and didn't work. And there's an Akkadian word, latku, that means tested, that appears at the end of some of these remedies to show that it's been tested and it works. So please trust me, the doctor. And this is quite old. I mean, even in, again, Hammurabi's time, there are descriptions of physicians testing a herb, for example, for something called setu, which is a kind of fever. So very interesting that we have both diagnoses and therapies in these medical texts.
But let me bring a bit of controversy, if you like. In a paper titled Neurology and Psychiatry in Babylon, published in Brain in 2014, so Edward Reynolds and Keenan Wilson argue that our knowledge of Babylonian descriptions, understanding, and treatment of psychiatric disorders is derived from various tablets and texts that are unrelated, they say, to the medical, diagnostic, and therapeutic series that you just described. Essentially, in a sense, reflecting the usual perception of psychiatry as an outcast of medicine. And they even go on to comment that the Babylonians had no knowledge of the brain or psychological function. Is that so?
So I'm going to disagree with that. And if I'm going to be really pedantic, for which I apologize, there is even one catalog for this diagnostic handbook. So a catalog is sort of a table of contents list that's usually kept separately from the actual tablets themselves as a record, like a library record. So there's a catalog for this diagnostic handbook that's currently in the, this tablet is currently in the British Museum, that separates the diseases into a compendium on illness and then compendium on depression, using the Akkadian word kuru for depression. That is unusual. As a general rule, psychiatry and psychology are not separate from the medical tradition. They're in fact very much woven into various other types of medical issues. And they certainly did recognize symptoms that have a mental or emotional component. That's visible in the terminology and the way these things are, these symptoms are organized together, but also in terminology for body parts. So there's a list that students would have copied in scribal context before they learned to become astronomers or accountants or physicians, and it's called in Sumerian it's ugumu, which means my head, and it lists the body parts from head to toe. And arguably one of these is sort of like, if you translate it literally, it's something like skull marrow, which could be the brain. But they didn't put the seat of cognition in the brain, even if it is referred to and recognized as an organ of the body. The seat of cognition is covered by other terminology, in particularly one word in Akkadian, which is libu, which can translate to either torso or belly or innards, but also heart. The literal organ that beats, there's at least one reference to it as beating in the Epic of Gilgamesh, or not beating when he's checking for a heartbeat, but also as a kind of emotive or noetic organ, an organ that thinks and feels, it talks, it feels anger, it breaks, it is low. So the heart is sort of like the brain. So even if they didn't recognize the brain as we know it, they recognized a brain. It was just located somewhere else.
Amazing. But what they did is that they clearly described symptoms of what we now call, neurological and psychiatric disorders. I mean, you've already mentioned something about, epilepsy. Although it seems that, all descriptions were, objective, that I see this, and that, which is not uncommon, as, subjective account of feelings and thoughts and behaviors are a relatively new phenomenon in medical texts. So can you give us some examples, if you have, pretty sure you have plenty, of some of the mental health disorders they described, and how did they do that?
Yeah, absolutely. And I hope it's okay. I'm going to read a few excerpts from some of these medical texts just to give a flavor for how they read, first of all, because we're not dealing with things like case histories or, strictly textbooks the way we understand very, elaborate descriptions of anatomy and, very kind of theoretical as well as practical books. But we can still meaningfully talk about symptoms, and I hope that will be clear from this example. So there's something that in Akkadian is shinitemi, which means altered mind or altered mentation, is a horrible translation, but that's kind of literally what it means. And we have a description of it in the Diagnostic Handbook alongside more observable symptoms. So if his mind continually alters and his tongue continually wanders, is one description. If his mind continually alters and his speech continually changes, whatever he speaks, he forgets. And then another, if his mind alters and his words stop. So we have descriptions of kind of speech issues that may be reflective of something going on below that they couldn't quite access, but they were trying to explain. So that's one example. There are also descriptions of confusion or different states of confusion. Something called seizing of the mouth also appears in quite a lot of therapeutic texts, as well as a symptom of stroke in diagnostic medical texts, although sometimes the diagnosis is that it is not a stroke. So what it could be, must be something else. With a lowercase d, there are descriptions of depression or depressed states. I say lowercase d because they were organized in, these depressed states are organized with symptoms that we might find familiar, but are also sometimes surprising. So sometimes they're described with quite physical symptoms. And here's one example from Ashur, again, the city I mentioned earlier, in which depression is grouped with heartbreak, which I hope we'll talk about shortly, headache, roaring ears, numbness, paralysis, chest pain, loss of appetite, nausea, shortness of breath, and hair standing on end. So is this depression? Maybe not, but depression is part of the symptomatology. Anxiety is also described. There are lots of terms for fear and for symptoms that are associated with fear, like nightmares or sleeplessness. And then there are also, again, physiological symptoms that go along with anxiety, that are described with anxiety, like low libido or appetite changes. So there are quite a lot of these medical texts and tons of symptoms, and it's really interesting to see how they were understood and organized.
Unbelievable. And I mean, you've already alluded to that, but the ancients were really creative and imaginative, when it came to interpreting symptoms. The ancient Greeks talked about how the uterus moves inside the body of a female, causing them a wide range of symptoms, all for them conveniently clustered, under the name hysteria. But one of the greatest, let's say, misconceptions that survives even nowadays in one form or another is the central role that heart plays in our thoughts and emotions. And interestingly, you wrote about, a tablet, a cuneiform tablet, essentially, as you said, it is like, correct me if I'm wrong, this is clay tablets, with words inscribed on it, that essentially now is housed in the British Museum. And since I mentioned the British Museum, I feel compelled to kindly ask them to return the marbles back to Greece. And back to the point, this cuneiform tablet talks about clear symptoms of anxiety produced by a broken heart, which is so, I don't know, I find it so romantic. So tell me about heartbreak.
Yes, absolutely. So yeah, what could really be more relatable than describing something like heartbreak? And in fact, the heartbreak in my analysis, which people may disagree with, is the anxiety. It's been translated, so a crash course in Akkadian. The words in this expression are chip, which means break or breaking. And again, we have libu, or it's libi in this case, but it can mean heart, insides, mood, mind, etc. So I think heartbreak is actually a good translation because it captures this kind of metaphor for an anxious state. It's been translated in various ways, though. Some have it's treated as a heart attack, as chest pain, as depression, or as anxiety. But in this, again, there's a whole section in the Therapeutic Handbook that addresses symptoms like heartbreak and including heartbreak. And there's a separate therapeutic text also from Ashur, a major library in Ashur that gives us so many medical texts, which describes heartbreak alongside fear, and the reason given, or the etiology given for it, is divine anger. So you've annoyed a god or goddess, and that god or goddess must be assuaged as part of the treatment. Another therapeutic text groups it with, again, fear, general upset, evil dreams or specific worries from everyday life like financial problems. So I think it really does clearly mean a kind of anxious state. And in letters from scholars to the king, they also complain about heartbreak in situations where they're stressed about their position in the court or their job security. It's probably quite relatable for scholars at the moment. But there are some wonderful letters, and wonderful in the sense that they give us real insights into the people behind these texts and not just these sort of dry objects from the ancient world. And one fellow called Urad Gula, who sort of lost his place in the court, he was sort of abandoned by the king, so to speak. He and his father, who is another scholar, both of them Ashipus actually, write to the king and beg him to forgive Urad Gula for whatever it was that he did to cause offense. And they both say we're suffering heartbreak as a result of having been
Wow.
back in the court. So yeah, so it's a technical medical term, but it also appears in these letters to show that people did suffer from anxiety.
Wow. I mean, in one of your articles, building on the notion that essentially there was no separate category for mental health and other physical illnesses, so you suggest that essentially there was no special stigma attached to mental distress in the Assyrian times. So is then stigma, mental health stigma, a byproduct of the mind-body dualism, you think?
This is such an interesting question, and I wish we could sort of spend half an hour answering just this because it is interesting that this dualism is perhaps maybe if we take the cause further back a little bit, is what led to the separation of mental experiences, let's say, from physical ones, and allowed for maybe different explanations to be given for those, predating sort of Western biomedicine, for example. So, for example, is the stigma a byproduct indirectly of that dualism in the sense that people associated mental illness with supernatural phenomena like demons, which is not the case in Mesopotamia. Everything is associated with supernatural phenomena. So I don't know. I mean, it's an interesting question. Or is it just something that people aren't comfortable talking about still, despite the fact that so many of us for thousands of years, since the earliest written texts, have suffered these problems? It's a very interesting question. I'd be interested to hear what other people think.
Moody, according to Herodotus, it was a common custom in Babylon to lay the sick, in the public square, so that passers-by who had suffered from similar complaints might give them advice as to what proved beneficial in their case. Like, let's say, a more social version of Google and online forums, if you like. And interestingly, there was a recent paper in JAMA Psychiatry talking about the effectiveness of peer-delivered self-management for rare chronic diseases. It's unbelievable. I mean, it's fascinating how little things essentially, have changed throughout the years. So on that note, do you feel that the Assyrians did anything better than us? Or if you like, what can we learn from the Assyrian colleagues of the past?
I mean, I think what's interesting about the history of medicine, especially the very ancient history of medicine, is that it's a finite and shared domain of inquiry. It's just the human body, which hasn't changed, in significant ways since the ancient world. So we can learn a lot about the way the body can be understood, outside of the way that we understand it now, or just to supplement our history of how we've understood ourselves. But I think another thing we can learn from them is something I just said, so I'm sorry to repeat myself, is that how old some of these experiences are, particularly experiences of mental distress and mental symptoms and mental illness, and that it was okay to get help for them from 3,000 years ago in ancient Assyria and Babylonia, and it's still okay today to do the same. I think that's one of the great lessons I feel of these texts.
One of the most famous sayings, comes from Professor Jorge Santayana of Harvard, who said that those who cannot remember the past are condemned to repeat it. And who better to remind us of the past than historians, right? So, but do you feel listened to? Or do you feel like an alarm that people keep on ignoring and snoozing until it rings again?
Uh, Maybe both. I mean, I can't speak for all historians, but history certainly can be used as a force for good and evil. It can be used and misused, so to speak. But I think if we're talking about ancient Mesopotamia, it can be a real force for good in the region. It can, again, you in the very generous introduction, you mentioned the Naharain Network, which is a project in cultural heritage and sustainability, in which history is sort of it is already part of everyday life, and how it can be used to improve the economy, society, how it can inform people's understandings of the areas where they live, and essentially just a force for good that recognizes that the past is still here. The past is very much present. So I hope we can end on a more of a positive note than.
No, Moudhy, no. This is the last question. I have the last question. To be honest, when I was reading an interview that you gave, when I read that interview, I was like, maybe I should cancel this BRAINCAST, because you were featured in History Today, and I have to say that unwillingly you broke my heart. So you were asked this really simple question: Rome or Athens? And you gave the wrong answer. You said Rome. So what is it that you have against Greeks, Moudhy?
So I would actually like to revise this entirely and pick Babylon. Is that okay?
That's fine. That's fine. BRAINCAST people, this is Dr. Moudhy Al-Rashid. Honestly, this was one of the most fascinating discussions we had in this series, as we managed to travel 4,000 years back in time in just less than 30 minutes. But we can't remain stuck in the past forever, right? We gotta move on. And from depression and anxiety in the ancient times to addictions in the modern times. No, we're not gonna go into talk about alcohol or any of the other usual suspects, but we will touch on a modern affliction that has sparked loads of controversy over the years: gaming. With me, the founder and director of the National Center for Gaming Disorders, the first NHS clinic in the UK treating what else? Gaming disorders. She also just happens to be the Psychiatrist of the Year 2020 and the current Psychiatry President of the Royal Society of Medicine, and so many other things that we need two BRAINCASTs to just talk about her accomplishments. Professor Henrietta Bowden-Jones. So, dust off your Nintendos, Xboxes, and PlayStations, because it's game on. Until then, Pospo and BRAINCAST for Monster Learning, over and out.